So any questions from either class about anything on the orientation from last week? Oh, wow. Okay. Okay, cool. All right. So here are my housekeeping items for my students. Do I have anybody, my students, other than Columbus, Norfolk, Salt Lake, Richmond, and Centerville? Are all those campuses represented with my group? Okay. All right. Excellent. Okay. For my group as well, I have to tell you that my favorite assignment to grade is the professional development plans. I think all the instructors feel this way. I love to read them and I love to grade them. That's my favorite assignment. So I just want to tell you ahead of time, I'm almost done grading. I'll be done by the end of today, but thoroughly enjoyed reading all your professional development plans. It's just so cool that this is a group of future nurses. So just love reading them, love reading about your goals, what you want to do in the future, and so inspirational. So I just want to let you guys know that up front, that your professional development plans are phenomenal. As my little 3-year-old grandson over in the UK would say, they are brilliant. So great job, everybody. Really great job. So I'm excited for all of you for your future goals. Just awesome. Sent you a couple of announcements this week. I'm sure Professor Price did as well. One announcement had 3 Kahoots in it. Okay, it was the updated week 1 Kahoots. It was another Kahoots regarding week 1, which was evidence-based practice, because we added chapter 10 in last week, right? And then there was a third one that I really want you to look at. And it was the primary, secondary, and tertiary interventions. Okay, because remember we talked about last week, this is a concept you must understand, you must get. So any practice you can get for understanding primary, secondary, and tertiary, there's a Kahoot about that. So has anybody had the chance to watch the week 1 Kahoot, the evidence-based practice Kahoot, or the primary, secondary, tertiary? Nobody. Okay. So my group last night, there were several that had watched at least the primary, secondary, and tertiary, and their feedback to the rest of the group was watch it. It was extremely, very helpful. Okay. So I would encourage you to, at some point, probably before exam 1, watch that. And as I told my prior 2 groups, there's probably a half a dozen questions on each exam that have to do with primary, secondary, and tertiary. So we have to understand that. Okay. What else do I want to review? NCLEX. You guys got my message about NCLEX, right? What are we supposed to do about NCLEX? Since the link is not in the community module, should be this term. We put it in for it, but it didn't get in there. So how are we supposed to access our NCLEX assignments? I'm asking you guys, tell me. I sent it in an announcement. What are you supposed to do?
The link in the modules.
There is no link.
Oh, okay, through Evolve.
Okay. So you have a link in student resources, correct? Which is your Evolve. And what's the other way you can get into NCLEX?
Through another class.
Exactly. Who said that?
I did.
Who's I? I don't know who's speaking.
Marisol.
Hey, Marisol. Yeah, thanks. Exactly. Through your other classes, right? Yep.
Miss Margell.
Right. Yes.
I just want to let you know, as far as the Kahoot games, remember I messaged you about the week 1. It's not like, I see the link, but it's not, you're not able to like click on it.
For a Kahoot?
Yes,
mean-
the
you
one
mean
that
the s-
says week.
Do you mean the
Yes, the-
I'm sorry, the second one I sent or the first?
Maybe, I'm not for sure. Let
I
me
know the
check
first, I know
again.
the first one doesn't work, right? Because that's when I realized that it
Okay.
had to be reset. It was taking you to the end, to the awards ceremony. I sent a second one where
Okay,
it was reset. And I have
Okay.
students from last night that, and yet both my classes yesterday that have watched it.
okay, cool. All right,
So,
thank you.
yeah, and then just let me know that it's working or if it's not working.
Okay,
Okay, so NCLEX. So let's see what else. Okay, so the last thing is I just want to go through, at least for my students, this is the routine every week. Okay, so you're going to get an announcement, right? It's going to give you PowerPoints for that chapter, for that week, right? So you got an announcement from me, a week 2 announcement. The way the week 2 announcement is usually, the introduction is usually a summary of the module. Okay, there's nothing new in the announcement. I usually just copy and paste the module and go through introduction, what chapters we're covering. Then I go into what's due and all that, right? Then I send you announcements. I send you 4 different things. I send you PowerPoints. Okay, PowerPoints are a summary of the chapter. So I don't spend time in class reviewing PowerPoints because I send that to you ahead of time so that you can do a quick review to see what we're going to be covering this week. Okay, I like to focus on the book. Okay, so PowerPoints, that's your introduction to what we're covering this week. So if you don't review them, you know, then you're not going to know what we're doing, which is fine if that's what you choose to do, right? The other thing I sent you is instructor case studies. These are case studies that I get through my lesson planning. So I send you those. And tell me, I know we talked a little bit about this either last week or I did it in my week 1 lecture. Why do I send you case studies? Why are case studies important? Okay, so case studies are important because of the rationales. Do you remember me talking about that? Anytime you can have access to case studies that have rationales, that's always an excellent learning tool. Rationales are excellent learning tools. Okay, so you have an instructor case study for each of the chapters. I like to try and cover those, try and get to those during class time, but a lot of times I don't have time to do that. So you have to do that case study on your own. Okay, with the rationales. Then the other 2 things I send you, they're called student case studies and practice application. These are simply 2 pages of answers to student learning activities in the book. Okay, every chapter has a practice application exercise and has most chapters have case studies. There's like 2 or 3 that don't. Okay, those are student case studies in your book, which I'll show you when we get there, that they're just additional activities for you to do. It says go to Evolve for the answers. You don't need to. I've already provided you the answers. So I'm trying to throw at you as many resources and learning opportunities as possible. It's up to you to take, to take it. And then I haven't sent it out yet because I need to know if week 2 Kahoots needs to be reset as well. So you'll be getting that. It's the only thing I haven't sent yet. So the 2 things that are, highly encouraged for you to do at the beginning or when you get them is review the PowerPoints and, take a look at the case study. Right. The other 2 are learning activities that are optional that you can do if you want to as you're going through the chapter. Okay, so that's how it's going to look every week. And then I jump into the book, right? Because the book is just the whole detailed version of the PowerPoint. And I try and pull out specific topics, concepts that we need to know. Remember I said last week, we don't need to know the whole book. We don't need to know every chapter start to finish. There's a couple of important topics and concepts to pull out of each chapter, and that's what we're doing. Okay, and then you have your study guide. Okay, so after today, every single thing on your study guide should have been covered by me or Professor Price, because Exam 1 covers weeks 1 and 2, right? And so I encourage my students within a couple of days after class, go back to your study of every week, go back to your study guide, highlight and check off what we covered. Right. So last week, all the information on your study guide from chapters 1, 2, 3, 10, and 21 should be highlighted. We already covered it. Right. And then the rest of your study guide will be covered today. Okay, so that's how the study guide works. We try and build the study guide off of what we're teaching in the first 2 weeks. And then next week is exam week, and we all know we take our exams during class. But at some point next week, you'll get study guide number 2, because I like to give you the study guides on the first week that the next exam is going to cover. Make sense? So that you can follow along. So for those of you that are planning, hopefully planning on attending a live review session at the end of the week, right? You know, about 2 Friday, 1 Saturday, 1 Sunday, right? My suggestion, don't come to those reviews thinking, yeah, I really didn't watch her week 1 content review that she sent on Saturday morning. I'll learn all that during the review. You're not going to. The review is a review. When I do my review, I cover the study guide. I don't go back and reteach anything from week 1 or 2. It's expected that you're caught up. Make sense? So don't come to the reviews thinking you're learning what you missed. You should come to the reviews having reviewed the study guide, compared it to your notes that you take in class, right? And if you don't understand something on the study guide, go research it in the book, try and get a better understanding. And then you should be coming to the review session with questions, right? I don't understand this concept. I don't understand what Family Medical Leave Act is. I don't understand what, what does a family in crisis mean? I've read the book, I've read the PowerPoint, I'm still not getting it. That's what you use a review for. Okay. So those are just my suggestions. Okay. And as I said last week, this is a team effort. Okay. We all want to get over the finish line. I will do whatever I can do to help you get over the finish line here with this class. And as I said last week, this is not a difficult class. This is a very manageable class. You just have to stay on top of it. Okay. And please prepare for exam 1. You just don't want to get behind on exam 1, because you end up being behind if you don't do well for the whole term. And it's stressful. Okay. If you've done the lectures, if you've done the notes for the lectures, if you've done case studies, if you've done some, any extra student activities that I've shared with you, if you've reviewed the study guide, and what was the other thing I was going to, you'll be fine. You'll be absolutely fine. You just have to put in some effort. Okay. So that's my, this is term number 6, and I've had 5 terms of, a group of students scoring way low in the exam 1. And I'm telling you from experience, you're behind all term. There's only 3 key graded assessments in this class. Well, 4, including the HESI, but you have 3 exams, weeks 3, 6, and 9. That's it. So spend the time. Okay. If you have a good understanding of the study guide, you're in good shape. You're in great shape. All right. So that's my rah-rah. Okay. That's my rah-rah for this morning. All right. Anybody have any questions before we get going? Oh God, I'm not going to talk for 2 hours. So I need you guys to jump in. Everybody's quiet. Can anybody else give us a rah-rah to get going here?
I think we all just might be really tired.
I know. Everybody's tired. I get it. I had a class. What?
It's a slow morning.
Okay. I have a class last night that I teach from 8 to 10 p.m. And last night I went right up to 10 p.m. because this is these 4 chapters have a lot of information I want to provide. And I felt terrible. Terrible. It's 10 o'clock at night. And these guys, my class on Monday nights that go from 8 to 10 have peds from 6 to 8. So I get them on they've already had 2 hours of class right before me. So I get it. I get it. Do you guys have a class directly after this? Or what do you have after this?
I don't have anything after this. I don't know about anyone else though.
Okay. All right. But my other 2 classes on Mondays, I have to get done on time because they go right to peds after my class, and it's the opposite at night. They're coming from peds. So yeah, it's hard. I don't know how you guys do it. I mean, really, it's, most of you are taking peds and med surg too. It's tough. This is a tough term. I get it. All I'm saying is just spend the time you need to spend on community and just move on to med surg and peds. I said that last week. Okay, just don't fall behind in this class because you're just making it up all term. You'll be fine. You'll be fine. Okay. Can I see a smile? Can I see some smiles? All right, there we go, Leanne. Leanne's got a big smile on. All right, Leanne's ready to go. She's giving me the thumbs up. Okay, all right, let's go. I'm sharing my screen. Let's see. Oh my gosh, where did all these things get opened up? Hello. Those are my 2 babies. Can you guys see them? That's Vivian and Harry.
They're adorable.
They're cute.
Aren't they cute?
Yeah.
He's the one who says everything is brilliant. Everything is brilliant. So anyway, okay, let's go. Let's get to the book. Okay, I'm going to start with chapter 18 here. Okay, so today we're covering chapter 18, 18, 19, 20, and 31, right? Okay, so the few things I want to mention to you as far as how to access the book and what each chapter, the important points. This chapter outline right here, this blue box is your PowerPoint. Okay, everything connects in this class. All the dots are connected. So your PowerPoint that you receive is this with more detailed information. So for example, what is family nursing in the community? Actually, hang on one second. No, I'm not going to go back through that. If you pull out your PowerPoint has all these headings. All right. And that has a little bit of information with each of them. Okay. Sometimes you can get the objectives out of your PowerPoint, right? Because right below this outline, right below this chapter outline are your objectives. And your objectives are always your page 2 of your PowerPoint. Same thing, same objectives in your PowerPoint, same objectives here. Okay, so it's a few things I want to point out. This information is not separate from your PowerPoint. We make the PowerPoint from this. Make sense? Okay, so if you follow along with what we're going to be covering here, these are all the sections, or most of them we'll be covering. It mirrors your PowerPoint. And then, as I told you guys last week, our objectives these are the objectives of each chapter. And after reading this chapter, the students should be able to. So here's your objectives. Here's what we're trying to accomplish in each chapter. Explain, identify, describe, work with. Okay. So that's our goal. Our goal is we should be able to do this after going through the chapter. Okay. So again, just to reiterate, I send you the PowerPoints ahead of time to review. Okay. PowerPoints are your outline, chapter outline. Then we look at our objectives. Okay, what do we want to get out of this chapter? Here, this is what we want to get out of this chapter. Okay, and then key terms. If you're reading through a PowerPoint and you don't understand what family structure is, or let's see, dysfunctional families, that comes up in your PowerPoint, you can click on the word, right? And it takes you right to the section of the chapter. Okay. So that's just basic outline of the chapter. I've already gone through the chapters and highlighted what we're going to talk about. A lot of students follow along with me and highlight in their books, which is fine. Take notes, whatever. Okay, so what we're going to cover in the chapters is the essential knowledge that we want you to have about important concepts on those topics. Right, so the first couple of chapters here are family, family assessment, family risks. Then we're going to talk about risks across the lifespan, and then we're going to talk about school nursing. Okay. And remember, take off your clinical pediatric hat, take off your clinical med-surg hat. We are jumping into the community. Okay. We are out there in the middle of the community right now. Okay. So don't think about ADPI in terms of a hospital patient. Think of ADPI out in the community. Okay. There's three things that we're gonna review. There's a lot we're going to review, but there's three particular things that I want you to be mindful of in each chapter that we're going to cover. Okay. One is Healthy People 2020. You need to be aware of what Healthy People 2020 goals are and objectives are in each chapter, because they're different based on the topic we're covering. Okay. Second thing in each chapter is your levels of prevention. There's going to be a box that has primary, secondary, and tertiary levels of prevention for whatever topic we're covering. So we have to be able to apply those levels to each chapter and apply ADPI to each chapter. And the third thing is the QSIN, the Quality Education Safety for Nurses. There are competencies. Okay, there's a good box in every chapter that identifies a certain competency. If you go back to chapter 1, when they introduced the QSIN, QSEN, it gave what the 6 competencies were that are going to be addressed throughout the book. And so I'll show you that when we get to it. But those are the 3 things that we must review you must review for every chapter. Okay. All right. So let's get going. I'm going to go through this quickly because we have a lot to cover, because you have your legwork to do as well. Okay. So I need to move you guys. So just for, let's see, let's go up there. Okay, so let's see, I've shared my screen. So the unlucky 3 are Tashana, Nina, and Leanne. Those are the only 3 I can see right now. So if I have to ask questions, you might get called on, just because you're the 3 up top that I can see. Okay, so family nursing in the community. Okay, what is it that all about, right? So as nurses in community health, we are responsible for helping families promote health within families, right? Meeting the family health needs. Remember, we're dealing with, in the community, our client could be an individual in the community. In the community, our client could be a family. In the community, our client could be the whole community population. In the community, our client could be an aggregate of the population, say the homeless, right? The teen pregnancy group, the addicted substance abuse group. Okay. So we are trying to help families promote their health, meeting family health needs, coping with health problems as it exists within their family structure, right? And then working with families to establish interventions. I mean, think about it. Every family is different. Every family is unique. Think about all the different issues we can face in the community when we're working with families. I mean, unlimited what we're faced with, right? Family demographics. Okay. The simple definition of family demographics is the study and structure of families. Okay. What is the definition of a family? For the purposes of this class, family refers to 2 or more individuals who depend on one another for emotional, physical, or financial support. Okay. So the 2 things we have to understand between, as we get going talking about families, is we need to know the difference between what a family function is and what family structure is. Okay. So each family has a variety of functions that makes up all the families. It looks different with every family, but it's the same 5 functions. And they're right here. Oops, they're right here. Ever since I found out my mouse, I can use my fingers to move it around. I try to, and it's like a nightmare. But anyway, here's your box 18.1 has your historical family functions. Okay, all families have these functions. It all looks different, but here's the 5 basic functions: economic function, reproductive, socialization, affective, and healthcare. Okay, so you need to know that there are 5 and what they are. You don't need to memorize this whole box, but you need to know that what the historical family functions are. Right? Families who have performed well in all these functions were considered healthy and good. Okay. And now that family functions have kind of evolved and changed over time, they've added a few more, right? Some have become more important, others less important. So some new functions that are becoming prominent in the new modern family is the relationship function and the health function. Okay, so those are the functions of the family. What's family structure? Family structure is what's your role? What are the roles in the family? I'm the mom. You're the dad. We have a grandma. We have a dog. We have 4 kids. We have whatever. It defines the roles and positions of the family members. Okay, so who are the individuals that make up the family unit? Okay, box 18.2 is it's not highlighted, but it's a good read for what different families might look like, right? What might a married family look like? What might a single parent family look like? Maybe a multi-adult household. What would that look like? Okay, so there's just some examples of that. Okay, let's talk about family health. Okay. One of the things we talk about with family health for purposes of this book is we talk about healthy families versus unhealthy families, functional families, dysfunctional families, balanced families, non-balanced families. All those words are used interchangeably. Okay. We know that individual health in a family affects everybody, right? If somebody gets sick, it affects the whole family, right? And we know that family health issues affect all the individuals, right? Right. So we tend to classify families in 2 groups: healthy families, non-healthy families. So here's what I just said: dysfunctional, balanced. So I want you to look at box 18.3. All right. When you look at this box, these 12 characteristics of a healthy family, what do you see? What's the common theme? That's a question.
The family?
Yep. Keep going. So what do you see? The family. What does it mean, the family? What are they talking about?
The functionality of a family?
Yep. What about the functionality of a family? What do you see here? What are they doing?
Hang on, I got to go back to my book.
Okay. I'll make it easy for you. It's one unit. They're doing everything as one unit. Okay. Does that make sense? They're doing everything
Yes.
together. Everything together. They share a sense of responsibility. They share their leisure time together. They share traditions and rituals. Okay. For purposes of this chapter, that is the primary characteristic of a healthy family, is they do everything together. They're one unit. So if you're asked, well, what is a dysfunctional family? Well, let's just read through these and make it a dysfunctional family. So family tends to communicate well and listen to all its members. Well, dysfunctional would say some family members communicate well and listen to others. Some have a sense of trust. Does that make sense? So that's the big difference. Doing everything as one unit and then kind of broken up and doing different things. All righty. Important to know. Because you're the community nurse, you're the one doing the family assessment. And so you're going to have to determine through your ADPI your assessment phase, what is this a healthy family or is it a not a healthy family? Okay. So families with strengths, functional families, and resilient families are usually those are the families referred to as healthy families. Okay. So here's our first box, levels of prevention. Okay. So we're talking about the introduction to families. So let's see what our levels of prevention are. So before we read this, right, we remember primary is prevention, secondary is screening, and tertiary is treating, right? And you noticed I haven't used the word education yet because I don't want you to get hung up that education is only in the primary prevention. Education is throughout all three of these levels. Okay, so for educating in primary, we're educating towards prevention, right? If we're educating at the secondary level, right, we have identified risks, right, through screening, whatever. So we need to educate on how to reduce those risks, right? And if you're educating at the tertiary level, let's say a group of kids who have diabetes, you're educating them, they already have diabetes, that's why it's tertiary. You're educating them on how to care for themselves, right? So I don't want you to get hung up on education just being primary. Make sense? So let's go through the first one in each of these. So primary prevention, educate parents about healthy nutritional choices for young children and the risks associated with obesity. Prevention, right? Everybody understand why that's prevention. They're not obese yet, but we want to try and prevent. We want to talk to them. You know, it's talking to kids in school about drugs and alcohol and nutrition, right? Trying to get to them before anything happens. Secondary, screening teens for obesity with BMIs above 30. We're screening them. I always think of secondary as early identification. We want to early identify those that might be at risk, right? So tertiary, okay, work with schools to improve the quality of food offered in school lunches. Why is that tertiary? Because we may have obese students in school, right? So we need to work with that school how to improve the quality of food offered. They already have the illness, they already have the issue. Okay, you with me on that? Okay. And we talked about this briefly, 4 approaches to family nursing, about how we look at the family. All right. The first is the family as a context, right? That is when we look at the individuals first. Okay. So the nurse might ask, you know, how has your new diagnosis of type 1 affected your family? We're focused on the individual first and how it's affecting the family. The opposite is the family as a client. The family is our primary client. Okay. And the individuals are second. So the nurse may say, tell me about what's been going on with your own health and how is everybody doing in response to your mom's diagnosis of cancer. Okay, so it's a family issue. Mom's been diagnosed with cancer. We want to know how everybody else is doing. Okay, family is a system, right? The family's viewed as an interacting system within the whole. Within the whole is more than the sum of its parts. So the nurse might say, what's changed between you and your spouse since your child had that injury? How do you feel about your son's long-term rehab? And how is it going to affect the family members? Okay. And then the last is looking at the family as a component of society. How does that family fit in? How do they fit in to the community? Are they engaged? Are they not engaged? Do they participate in, do they utilize resources? So what's their interaction with the bigger community? Okay. There is a theory, but we'll get to it in a minute. We're going to skip some parts here. Okay. So Working with families for healthy outcomes. This next section you can read through. It's the steps that we go through to meet with a family. Okay. And as you're reading, right? So pre-encounter data collection. All right. Think of your ADPI. Okay. Here's all the steps. Okay. So you pre-encounter data collection. And I just need you to know the steps. And you know what's in each step. We don't need to know everything in the book, but just have an idea of what's in each step. And again, apply your ADPI. Determine where to meet the family. Make an appointment with a family. If they have a box such as how to make an appointment with a family, that box is directed to the section we're in. So for example, they talk about making an appointment with the family. Then they give you a nice how-to box of how to make an appointment with the family. Okay. The one thing I want to focus on, there's several steps: pre-encounter, determining where to meet the family, making an appointment, planning for safety. I'm going to come back to that. Interviewing the family, so you're defining the problem. Again, think ADPI. Okay. The most important thing with regards to interviewing is you have to establish trust. Right? Some families may want you there, some families may not. Some families are very secretive and don't open up. What strategies of communication can you use when you interview? Okay, so under interviewing the family, there's a nice little box of 18.6 for interview suggestions of interview questions. And then designing interventions. Okay, and then this check your practice and your case study that I provide you the answers to are under the section of interventions. Right, so that's some helpful information with regards to interventions. Then the last part of it is evaluation. Okay, so we've just gone through the whole ADPI of meeting with the family. Okay, there's 6 or 7 steps. Okay, it's your ADPI, but I do want to go back and highlight this part. Okay, that's really important in community health, right? How do you plan for personal safety? Right? What are some home visiting safety tips? I want you to review this. It's on 302. Okay. We need to keep in mind our own personal safety when making a home visit. We need to know about the neighborhood, right? Anticipate, what risks there are, right? Do you need a security person with you? Is your phone fully charged? Those kinds of things. And here's some safety tips. Right? Leave your schedule at the office, plan a visit during safe times of the day. Avoid secluded places. Why is this one important? Sit between the client and the exit. Why is that important?
In case you need to
In
get out.
case anything happens, you know how to get out,
Absolutely.
or you're able to get out.
Yep, absolutely. Checking in with your agency at the end of the day. Right? Making sure they want to know you got through all your visits, everything's fine, you're fine. Okay. All right. So go back and put these, let's see, 1, 2, 3, 4, 5, 6. There's 7 steps. Okay. In meeting with the family. So go through that, or at least know what the steps are. Okay. Again, this is how we apply our ADPI in the community. That's what those 7 steps are. They don't say assessment, planning, or assessment, diagnosis, planning, but there's another word for it, right? In the community. Okay. How do we do a family nursing assessment, or why? Family nursing assessment is the cornerstone for family nursing interventions, right? And it talks about by using a systemic process, which is our ADPI, we identify problems, we identify family strengths, weaknesses, we engage them in helping us to talk about interventions. We put those interventions in place, and then we evaluate it as a group. We have to have the family involved in the family nursing assessment. Okay, if they buy in, if they're engaged and involved, hopefully the interventions are going to be more successful. Okay, then here's that QSIN box I was talking about. QSIN is quality and safety education for nurses. Okay, they're competencies. They're in chapter 1. The introduction to it is in chapter 1, where the 6 competencies are laid out. And then each chapter picks a competency and talks about it. Okay, so in this particular chapter, the targeted competency, one of the 6 is client-centered care. This is a really good box to read because our nursing care is all about competencies, right? So this particular chapter, they focus on client-centered care. Okay, and then they talk about important aspects of client-centered care. This is every chapter. They'll have a different competency up here, but you always will have knowledge, skills, and attitudes. Okay, how is child-centered? How is this aspect of what aspects of client-centered care would include in this chapter? Knowledge, skills, attitudes. And then they always give you a client-centered question. They always give you a question to think about, to ponder. So this is one of 2 boxes that I want you to look at in each chapter. Levels of prevention, focus on quality, or quality and safety education for nurses. And then this is the family assessment model I wanted to bring to your attention. The most common family assessment model is the Friedman family assessment model. Okay, and this is heavily based on the differences between the function and the structure of a family. Remember we talked about that? The 5 functions of the family, and then your structure is all your roles and responsibilities in the family. Okay, so that's what this system is, this assessment model is based on. And then I have highlighted here some of the guidelines for the Friedman assessment, family assessment model. They talk about 6 different categories of interview questions, right? And again, think ADPI, identifying data, development of where's the family in its developmental stage, and history. Environmental data, what's the family structure? What are the power structures, role structures, values, right? So that's the one model that we just want to be aware that the Friedman family assessment model is the most common and widely adopted family assessment model. Okay. And then our third box is our Healthy People 2020 box that we have in every chapter. And it covers the Healthy People 2020, our goals and objectives, right? And in this chapter, it's for families and family nursing, right? So don't worry about these letters. This is, if you were to go to Healthy People 2020 website, these are the sections they're found in. I have a list somewhere of what EMC means, but you don't need to worry about that unless you're going back to the Healthy People 2020 website. Okay, so here are their 6 goals, right? So let's just review a couple. Increase the proportion of parents who use positive parenting and communicate with their health providers about positive parenting. Pretty positive objective. Okay. Second one, increase the proportion of adolescents who talk to their parent or guardian about reproductive health topics before they're 18. Okay, so when there are Healthy People 2020 questions on your exams, okay, there's several. And so when you're asked about what are Healthy People 2020 goals and objectives for family and family nursing, if they're asking about this chapter, the only answers that are correct are any of these 6. We could probably think of 60 more decent, appropriate goals and objectives, but that's not Healthy People 2020. So it really is that they want to know, the questions want to hone in on what are Healthy People 2020 specific goals and objectives. So if you're asked about this chapter, anything that's outside of these 6 is not the correct answer. It may sound good, but it's not part of Healthy People 2020. I can't stress that enough. It makes me nuts when students get Healthy People 2020 questions incorrect. And then we go and review the questions. They say, well, yeah, it sounded good, right? It sounded good. but was it Healthy People 2020? So I would suggest you maybe pull out the Healthy People 2020 goals and objectives and put them on an index card. Pull out the levels of prevention for this particular chapter, put them on an index card. Okay. And if you keep reading these quality and safety education competencies, these QSIN boxes, every chapter, you're going to really have a good understanding of the 6 competencies. Make sense? Okay, that's chapter 18. Any questions about, oops, sorry. Let me get my mouse back here. Any questions about family development, family nursing assessments? Let's talk about family risks. Now we're moving into chapter 19. Same thing. Your PowerPoint is exactly this chapter outline. Okay, with additional detailed information. Okay, so you can follow along your PowerPoint in this chapter outline. Okay, so here's what we're going to be covering in this chapter. Okay, here's our objectives. After reading this chapter, we should be able to do this: analyze, determine, understand, explain, discuss, all these things. Determine major risks of family health. Understand the interrelationships among individual health, family health, community health. So remember, in the community, our client may be a simple individual, our client may be a family, our client may be the whole community, our client may be the homeless population in the community, it may be the HIV population in the community, maybe the elderly in the community. Okay. And then all your key terms. You know, if you get to a key term in the book or in your PowerPoint you don't understand, come back to the book, click on it, and we'll take you to it. Okay. Okay. Historically, studies of family, when we study families with regards to health and illness, it's usually focused on, historically, 3 major areas, right? How does the illness, how does it have an effect on families, right? What is the family's role in the cause of the illness or the disease, right? And how is the family using services to deal with, cope with family illnesses? Okay, I love this little paragraph or sentence right here. The energized family, so this would be the healthy family, is characterized as one that promotes freedom and change, is actively engaged with a variety of other groups and organizations, has flexible role relationships, equal power structure, high degree of autonomy, right? So right off the bat here, well, let's talk about risk. Risk, what's risk? We take risks every day, all day. What's risk? The probability that something might happen, right? You drive your car knowing the risk that there is a probability, small, but that you might get in a car accident, right? You take the risk of smoking knowing that there's a probability that you might get lung cancer. We're always taking risks. Okay. So for this chapter, concept of risk, which refers to the factor, refers to a factor predisposing us to the likelihood that something's going to happen. This is really important in family health, right? Because there's so many risks. Think about all the risks in the community. All right. Physical risks, psychological risks, behavioral risks. Okay. So Healthy People 2020 comes up real quick in this chapter. There's only 2 goals, 2 objectives. Okay. Eliminate very low food security among children in the US and increase proportion of smoke-free homes. Pretty important stuff. Okay, so what are the concepts of family risk? Okay, well, one of the concepts is family health. Right? Family health is determined by 5 sets of interacting factors. Okay, this is the makeup in every family. It just looks different in every family. Okay, so your 5 interacting factors are physiological, psychological, sociocultural, developmental, and spiritual. Right? The family is seen as a whole system with these 5 interacting factors. Okay, so I just need you to, what I need you to know is these are 5 interacting factors that is the makeup of assessing family health in all families. Okay, and take a look at this right here. It's page 313. They give us a little scenario of the Harris family. Okay, and then they identify these 5 interacting factors and tell you how they apply to the Harris family, to the scenario. Okay, so have a look at that. And then another concept is health risks. How do we define risks? We could have biological risk, which could be age-related, hereditary. We could have environmental risks. We could have behavioral risks. Okay, and we'll talk about those. Another concept is health risk appraisal. How do we do a risk appraisal? Right? Are there certain risk factors that are more prevalent with certain populations? Okay. Think of, that talks about automobile accidents. Young kids just getting their licenses are more at risk for car accidents, right? Look at COVID. The elderly was much more at risk of getting COVID and getting sicker, right? Maybe SIDS, sudden infant death is more, infants are more at risk. So we have to be able to do a health risk appraisal. And then we have to identify what are our health risk reduction actions going to be, right? Hoping to reduce the risk of an event occurring. So let's take COVID. What are we going to do for the elderly population to try and get them to be less at risk or decrease the risk of a certain, of them getting COVID? Vaccines, right?
Vaccines, masks,
Exactly. That's
ensuring
health.
proper hygiene.
Yeah, that's health risk reduction. And then another concept we have to look at is family crisis. What's family crisis? Family crisis, the definition in the book is that they're not able to cope with an event and everything becomes very disorganized and dysfunctional, right? The demands of the situation exceed the resources in the family. I mean, this is what we're going to be faced with in the community if you're working with families. How do you identify a family in crisis? What are the signs? How do you help them with coping strategies? Okay. So, major family health risks and nursing interventions. Right. So as mentioned before, risks to the family typically come from 3 major areas: biological, biological, environmental, and behavioral. Okay, we're going to go through those. Okay, we're in biological now. Okay, biological health risk assessment. I still have people coming in, which is fine. But make sure everybody has put their name and their professor in the chat box. Okay. Monica, your baby is 5. Okay, biological. I need you guys to understand this. Every time I do exam reviews and students get questions wrong about genograms and ecomaps, I just feel like I haven't explained it. accurately. So part of the biological risk assessment, that's kind of what we call hereditary. Okay. One of the most effective techniques for assessing the patterns of health and illness, it's called a genogram. This is the biological health assessment, where we go back 3 generations and we find out what happened. Okay. Who died of what? Who had certain diseases? Who, what was the health of the last 3 generations? Right. So it's a drawing. This is what it looks like. Page 316. Okay. It uses several generations in trying to connect dots. We get basic information about the family, relationships in the family, patterns of health and illness. Okay. And I use my own personal example to try and explain this. Okay. A couple of years ago, I was diagnosed with breast cancer. We don't have any family history of breast cancer, zippo. We have a lot of other things going on, but not that. So I had to go back and do one of these, go back 3 generations, find out who else in my family has died of cancer, what kind of cancer. Okay. So that was a way for us to go back and try and connect the dots. We weren't really able to connect any dots. Okay. And so because it was unknown, it hadn't happened before, I was a candidate for genetic testing. Okay. So I want you to think about genogram and genetic testing in the same. Not
Would that be more
everybody's,
environmental though, as well?
pardon me?
Would that be environmental factors as well?
No, we're going to get to environmental factors. This is biological assessment.
Okay, touche.
Okay. And so I was a candidate and I wanted to do it because I wanted to figure out, because I have a daughter, if there was something that I would be passing down to her. So I went through all of that. So what I want you to know is the genome is the biological assessment of going back in history a couple of generations to figure out what's going on or what happened. So there may be families that have history of alcoholism, families, history of cardiac disease, history of strokes, history of cancer, history of whatever. Okay. But genetic testing is usually reserved for the unknown. Okay. Not everybody. If you come from a family that has a cardiac history, you're going to be predisposed to cardiac issues. If you have a family history, it just goes with, it's automatic. If you have a family history of alcoholism, you're going to be predisposed to that. Okay. So I didn't have a family history of breast cancer, so I wasn't predisposed to it. So I had to go through the testing to see if it's starting out with my generation. Does that make sense? So that is what a genome is. Okay. That's what it looks like. Okay. You're going all the way back, historical. Okay. And then here's where we talk about genetics and family risk, and we talk about the genetic testing. Okay. What I need you to know about genetic testing is it's not for everybody. If you already know you're predisposed, it's not for that. Okay. And then important, genetic testing decisions are very personal and complex, can be controversial. Okay. It's important to respect other people's decisions. Somebody in my situation may have not wanted to get genetic testing because they didn't want to know. I did, but you have to respect everybody's personal decision-making process. All you can do is provide information, right? So, okay, and here's the environmental risk. Okay, here's the other part. Here's the opposite of genome, not the opposite, but another way to do, and it's part of the assessment is an environmental risk. Environmental risks are considered social risks. Okay, what do we mean by that? Okay, the poorer population are at greater risk for health problems. We know that. Economic risk. Write this down. The primary leading indicator of risk has to do with your economic stability, right? What happens if you have economic instability? Okay. There's trouble with financial resources, right? Housing, it could affect
Excuse me.
housing, clothing, food, school, illnesses. It affects everything.
Can you repeat that again about why the primary of what? The primary. We'll just repeat what you just said. about
So
the-
so the financial stability of a family really determines a lot. Okay,
Thank you.
so if you are poor, poverty level, you're going to face many more economic, environmental risks than, say, a family whose economic situation was stable. You will have issues with housing, clothing, food, school, medication, right? And so the economic, financial stability of a family is a great driver of what's going on. Okay. Now, there may be a situation where the family may be above the poverty level, but there's been a significant illness in the family that has wiped them out. I mentioned to you as far as how to act.
So that is specific to environmental rather than the other bio and behavioral.
Bio, we haven't got to behavioral yet. We've done bio, which is your kind of age-related, history, hereditary. Okay. Environmental is your social risk. So now we're talking about environmental in the community. Okay. Are you with me, Leanne?
I am. I just thought that the economic stability would kind of cover all of those levels.
Well, economic stability is mentioned here in our environmental risks.
Okay,
Okay.
thanks.
And then what is it? How do you do an environmental risk assessment? This is what we call an eco map. Okay, where it talks about what is the social risk. What are the social risks? What are the interactions with the community? What are the relationships? Okay, what are the relationships the family has with others in the community? Do they have other family members? Do they have relatives, neighbors? What are their connections with church, school, work, clubs, organizations? Okay. We can assess all this through the use of an eco map. So it says it right here. An eco map represents the family's interactions with other groups and organizations. Okay, so here's what an eco map looks like. So let's take my family, for example. Our family, my family's right here in the middle, right? Big circle, that's my family. All these little lines out is our social network, right? Relatives, sports, church, book club, whatever. Okay, so I have a really big social network. That's good. Okay, it's an eco map. It's social interactions with the community. Okay, what we don't want to see is just a plain old circle. That's it. What does that tell you? What will just a plain old circle tell you?
Unknown.
It will tell you that there's not connections with the community, right? Very isolated family, which brings on its own concerns. So what happened? So let's say this is my circle. What happened during COVID? All these things went away, right? And we just had all these families out there isolated all by themselves, right? We couldn't visit family. We couldn't go to the grocery store or whatever. We couldn't, go to the church. We couldn't go to the rec center. Everything was closed, right? So we had all these little circles out there of all these isolated families. We didn't have all these boxes. Now we're starting to build them back up again, which is great. But what you want to see is a big social structure, right? Because what happens when you have just an isolated family with no connections? What's going on? What's happening? Make sense? Now, I want to make sure you guys understand the difference between these two because you need to. Do you understand about this? Social network. It's your social network. Okay. So, Leanne, here you go. Economic risk is the key predictor of health. Okay. That's what we need to know. And then behavioral, you guys could, I want you to understand that biological and environmental. Behavioral is a third. You can, behavioral risks are, you know, drug use, alcohol, social and health problems. Okay. You can read through the behavioral section. Okay. Let's see. Personal health habits continue to contribute to the major causes of morbidity and mortality. Right. So behavioral, the pattern of personal health habits and behavioral risk define the individual, family, and family lifestyle risk. Right. Your behaviors are your choices. Right. Many family health risks can be reduced by careful attention to diet, exercise, and stress management. Just think about it. Behaviors are our choices to make. Okay. So again, down here, we get into, drug use, alcohol, major social health problems that affect individuals, families, and communities. And then going back to functional versus dysfunctional family, the literature suggests, consistently identifies the following factors that decrease the substance abuse for children: family closeness, families doing activities together, and good behavior modeled in the family. Okay. Home visits. Okay, home visits, they say, are really the most important part of community health. And when you do a home visit, you can assess everything, right? Let's say you're going in there to change a dressing on a wound. What else can you assess?
Living conditions.
Living conditions, food security,
Family
family dynamics, communication, relationships, safety, environmental risks, behavioral risks, right? So a couple of things, I'm going to keep moving along because you're going to have to go back and review these on your own. As far as home visits, we need to know table 19.2. What are the phases and activities of a home visit? There's 5. Okay, think ADPI. I'm on page 323. There's 5 phases of a home visit. You don't need to memorize all of this, but you do need to know there's 5 phases and what's the general goal of each phase. Think ADPI. This is ADPI transcribed into the community. Okay. And then it goes through each section here. Okay. Here's your QSIN. Here's your quality and safety education. This chapter talks the competency of safety. So have a look at this. What are the important aspects of this competency with regards to knowledge, skills, and attitude? It gives you a question. And actually here it gives you an answer. This is a good QSIN box. Chapter 19. Okay. And again, it's going through each of the phases. Okay. And then there's a section on contracting families. Contracting, what is contracting? It's a joint agreement. You're contracting with family. You're contracting and working with the family about a specific issue. Okay. And I need you to know what table 19.3. What are the 3 phases of contacting? Again, you don't have to memorize all of this in the box, but you need to know there's 3 phases and what makes up each phase. So if you get asked a question, here's the scenario you're presented. What phase are we talking about? What phase are we in? What if the question on the exam asks, so we're currently working, contracting with the family, and we're currently working in the division of responsibilities. What phase would we be working in? The working phase. Okay. And then here's our levels of prevention. I'm going to have you go back and review it. Okay. So I want to keep going. Okay. and the levels of prevention are related to the information, the topics in this chapter. Okay, I can just pull out a few words here. Prevent, right? Prevent. Behavioral risk survey, right? Risk survey, screening. Surveys are screening, right? Nutritional patterns to reduce further complications, so they already have something. All right. So there's just some keywords to pull out with each level of prevention. Okay. Okay. And there's your practice application that you have the answers to. You don't have to go to the Evolve website. It's right there. Okay. I want to get to chapter 20 because this is kind of a big one. Okay. So as we talked about community, you are dealing with the entire lifespan. Okay. Why is this not coming up? This is health risks. This chapter is health risks across the lifespan. My internet connection is unstable. Oh, awesome. Great. Let's see. Let's see if I can get out of here and pull this back up again. So I'm going to stop sharing for a minute. Oh, I can't minimize when I'm on. Okay. I'm just trying to kind of reset this. That's all I'm trying to do. Get out of here. Let me go to here. For all of you guys that are coming in the last 5 or 10 minutes, put your name, please, in the name and your professor in the chat. Okay. Health risks across the lifespan. This is, I told you last week, in community health, you're pulling everything. You're bringing everything into this. Okay. Meaning you're going to be working with infants all the way to the elderly. Okay. You may be working, you are going to be pulling in maternity, leadership, mental health, peds, right? Bringing everything, right? Because think of everything you might be dealing with if you're working with people across the entire lifespan. Okay. So again, your PowerPoint that you received is this chapter outline right here. That's your PowerPoint with additional information in each of these areas. Okay. So this is a big chapter. We're covering a lot. I mean, I'm pulling out what we need to know. We won't cover the entire chapter cover to cover, but there's a lot to know in here. Okay. And what are our objectives? After reading this chapter, we should be able to discuss major health problems of kids and adolescents. Discuss risk factors of adults. What are the risk factors of men and women? Remember the topic of this chapter, health risks across the lifespan. Every group has different risks. There's your key words. Okay. We know that the health and well-being of our children have a significant impact on the future. Right? We need to keep them healthy. Right? Immunizations, regular primary care doctor follow-ups, dental follow-ups. Some kids have health insurance, some kids don't. The ones that don't, how do we help them with access? All right. These kids are the most vulnerable, right? Their physical, cognitive, and emotional changes are happening rapidly during childhood. We have to be mindful of that. Okay, some big problems that we have to deal with. Obesity, right? That whole section is about obesity. We need to know box 20, if we're working with obesity is a huge problem with kids. We need to know box 20.1. If you're working with a family that has obese kids, or you're trying to be proactive with them, what are your recommendations? What do you talk to them about? Family recommendations for obesity, right? I mean, this should all make sense to you. A parent that says, well, we just do fruit juices, it's fine. We do it, all 3 meals, 100% fruit juice. Is that a problem? Kind of, right? The family, what's the other one I bring up? The cooking. Here's the cooking one. Do we want to bake our food or do we want to fry it? Okay, so right here, cook meals at home. Do you want to broil, bake, stir fry? Those are the ways to cook rather than frying. So you don't need to memorize this, but just have an understanding. If you're asked about this, that you're having a conversation with a parent, what kinds of things would you guys talk about with regards to obesity prevention? And when I read this, all of these, they're kind of no-brainers, right? And then injuries. Injuries is huge. Injuries and accidents are the most common cause of preventable diseases and disability and death among children, right? And then we talk about unintentional injuries, fire, falls, drowning, suffocation, sports injuries, motor vehicle accidents, right? And then we go through each of the groups. Here, your QSIN is your competencies, client-centered care. So now you're going to learn about client-centered care, the competency of client-centered care. So have a read of that box. So you need to read through the developmental considerations of each of these groups. So for example, infants, right? What are they at high risk for? It's on your study guide. Infants, they're at high risk for SIDS, right? Toddlers and preschoolers, what are they high risk for? When we think of school age kids, we think of, in the book, we talk about riding a bicycle. So then we talk about safety, helmets, right? Adolescents, motor vehicles, seatbelt safety. Each group has its own issues. How do we prevent injuries? Right? We play a role in teaching parents how, educating them on the prevention of injuries and accidents. Okay. And here's a good list, 20.2 of injury prevention topics: car seats, seat belts. How do you, talking to parents about preventing fires and burns, bicycle safety, safe driving practices, sports safety. It's all part of our job as a community nurse. I mean, you don't really think about these things, right? Let's just stop and pause for a minute. Just want to stop and share. You don't really think about these things, right? But think about how much, if you really are working in the community as a community nurse, think of all the areas and subjects and topics and issues you can be involved with, right? Okay. And believe it or not, you have to know about playground safety, box 20.3, guidelines for playground safety. Let's assume that you're the community health nurse for your community, and the city people have come to you and said, hey, we just got a big grant and we're to build a big playground out in front of the rec center. But we don't really know much about playground safety. You're our community nurse. What do we need to do? What do we need to not do? Right? So here's a short list of some guidelines. Those are the kinds of things you might get involved in. And then the next topic is gun violence. Okay, we know that gun violence is another significant risk factor to children, right? Kids are curious, they pick up guns without understanding the danger involved. Okay, I do want you to read this section. It's on page 339 right here. It's right under your playground safety. I've highlighted most of it. So I want you to read this, but what I really want you to know is, well, if you're in the house doing a home visit, what is the first question you ask the family? Do you have any weapons? Are there any firearms in the home? Why do you ask that question?
For your safety.
Okay, if the answer is no, move on. If the answer is yes, what's your next question or request?
Where do
How
you
are they
start?
stored? How are they stored? Where are they stored? Do the kids have access to them?
Perfect. Perfect. And you take that one step further. Yes, there are firearms in the house. Okay. Could you please show me where they are? You want to physically see that they are secured
And
and
not loaded.
locked appropriately. Right? I mean, I know it sounds intrusive. I get that. And one of my very first terms, I had a student, a female student, who is a gun safety instructor. And she said, she argued and argued. She goes, there is no way if you come into my home that I would show you where anything is. I go, you know what? Can you just go with me with this chapter, please? What we're asking you to do is please ask the family to have them show you, physically show you where the guns are locked up, to make sure they are stored and locked up safely. Okay. So have a look at that part, but it is an issue. And then certainly child maltreatment, neglect, abuse, and there's a whole chapter on that, but we all know, I don't have to review the fact that we are all mandatory reporters, correct? Everybody knows what that is, what our responsibility is, right? You're just not mandatorily reporting in the home. What if you're in the grocery store and you see something? You're supposed to report it? Do you need to report it?
Yes.
Okay, what about if you're at the park? What about if you're off work? What about if you're at a sporting event? Does it matter?
Yes.
Doesn't matter. You have to report. And then we think we're still in the kids section, but we think about behavior, mental health problems with kids, ADHD, autism, anxiety, lots of stuff going on with our kids. And being in schools for 20 years, there's a lot of stuff going on with kids, a lot. School nursing looks way different than it did 20 years ago. Acute illnesses. Do you guys know about, I don't know, lice, checking for lice? What about conjunctivitis? Do you know how to recognize conjunctivitis? Okay. You may be doing box 20.4 routinely, simply teaching families about good hand washing. Okay. And then chronic health conditions with the kids, right? Down syndrome, spina bifida, CP. Going to be working with that as well. What if you have a family, kids that are hugely impacted require a lot of care. They may have a lot of outside appointments, PT, OT. Can the parents keep up with making those appointments and getting kids to those appointments? That's hugely part of your assessment, right? Are the kids getting to their appointments? Are they getting the care they need? If they're not, they may need your support in helping them coordinate. Right? So we have to think about that. Think about asthma. What if you're working with a family that is not a smoke-free home and the kids have asthma? Is that a problem?
Yes.
Big problem. Big problem. Read this section about asthma, 341. You have to work with families to establish the end goal of a smoke-free home. What if a parent says to you, don't worry about it. I used to smoke 3 packs, I only smoke 2 packs. Is that a problem?
Yes.
Of course it is. What if the parent says, you know what, don't worry about it. I just started vaping. Is that a problem?
Yes.
Yes.
Of course it is. I mean, if the parent says to
Nope.
you, hey, you know what, I'm going outside and smoking. Okay, that's
Nope.
better, but it doesn't solve the problem. So what can we do with families? Offer them outreach programs, maybe smoking cessation programs, right? We have to get to the end goal of a smoke-free environment for these kids. All right. And here's your smoking. How to discourage parents from interventions to discourage smoking, focus on the parent, the child, and public policy. Parents should be offered educational programs, interventions, ways to create a smoke-free environment. Okay. And then I need you to know these 5 examples of federal legislation. I'm going to have you go back and read through it because I want to get to chapter 31. But there are 5 federal legislation acts I want you to know about. And I have them highlighted right here, page 343. You just need to be aware of what the act is and what it's about. Okay, so the Older Americans Act right here. Americans with Disability. Patient Self-Determination Act. Okay, that one, if a patient becomes incapacitated, what do? We have to have in writing what they want to do. That's like your living will, your health directive. Okay. But what we have to remember about the Patient Self-Determination Act is if the patient is competent, we want them participating in every aspect of their care. Right. So we have the Older Americans Act, the Americans with Disabilities Act, Patient Self-Determination Act, and then Family and Medical Leave Act, FMLA. We know about that, right? I should be able to take time off to care for my ill child or ill parent. And then the last one is right here, it's called the welfare reform, but it's technically called Personal Responsibility and Work Opportunity Reconciliation Act. So know that there are 5 federal legislation acts. You may get asked about this. You may get presented a scenario and you're asked what act applies here. Okay, maybe a question about somebody with a disability. How is somebody with a disability protected? What's the answer? ADA. Right? Americans with Disabilities Act. You may get a question that says, mom's taken time off to take care of her elderly or her newly diagnosed son that has a chronic. Yeah. Second, mom's taking time off to take care of her ill child who is just diagnosed with a chronic illness. How is she protected? FMLA. So just know what these are. Okay. And then there's always going to be legal and ethical issues for older adults. Okay. This is page 344. Here's where the topic of elderly abuse comes in. Here's the introduction to elder abuse. Okay. So the most common of these issues involves decision-making. We're doing an assessment of the ability of the clients to make decisions, right? If they have the ability, wonderful. If they don't, what needs to happen? Okay. So here's your introduction. Often overlooked are elderly abuse, right? It can be physical, psychological, financial, social. It's simply a violation of their individual rights, right? They have, the elderly, the National Center on Elder Abuse, okay, which is their representation for elder abuse. Kind of like we talked above, FMLA, ADA, there is a National Center on Elder Abuse, right? It encompasses physical, emotional, sexual, as well as exploitation, neglect, and abandonment. And then it gives you abuse consists of the following. And here's 4 bullet points of what elder abuse may look like. And it goes through each of them. Okay. Other important point to remember is here, chronic illness. Chronic illness is one of the biggest challenges in public health, chronic health, or community health, right? Because people are living longer. Chronic illnesses are very, very prevalent in community health. But as we're caring for elderly or clients with chronic illnesses, what is our goal? Our goal is to continue to help them achieve the highest possible of quality of life, right? We want them to try and be as self-sufficient as possible. I want you to read this right here, page 344. It gives you several examples of what we're doing, what we can do with clients with chronic illness, right? We know we can't cure it, okay, but what we can do several other things, right? We can try and minimize the signs and symptoms. We can try and help them maintain self-care, maybe manage the side effects of the disease, boost the body's healing abilities, prevent complications, delay deterioration or decline. What can we not do? What can we not do?
Reverse the condition.
Can't reverse it, can't cure it, and primarily we cannot prevent death. Okay, so what do we work towards? Number 7 here, dying with comfort, peace, and dignity. Okay, here's your Healthy People 2020 box, and it's related to major health issues and chronic disease. So have a look at those. Okay, and here's your levels of prevention. Okay, this is for a woman. Primary prevention for cardiovascular disease in women, right? Primary is reduce women's risk, right? Secondary, establish screening clinics. Tertiary, develop an exercise-based program for women who already have cardiovascular disease. Are you starting to get a better understanding of primary, secondary, tertiary? Mental illness is another issue, cancer, okay, weight control. And then we have a section, know what the few women's health concerns are, and know what the few men's health, primary women's health and primary men's health concerns for women: eating disorders, reproductive health, gestational diabetes, obviously that's with pregnancy, menopause, osteoporosis. And then you have some men's cancers. Okay, prostate cancer, testicular cancer, ED. Okay, and then you can read through this section. There's certain groups that health disparities are present. Okay, what's health disparities? Okay, that maybe they receive the different kinds of care. They have different kinds of access, less access to care. That's what a disparity is. Okay, and here's the 4 groups that are identified. So all you need to know is who the 4 groups are: adults of color, incarcerated adults, LGBT. There's 5 actually. Adults with physical and mental disabilities, and the elderly, frail elderly. Those are the 5 main groups that will experience some kind of health disparity. Care, access, treatment. Okay. And then the last section I want you to read through, let's assume community care settings. Let's assume, I'll give an example. Let's assume my mother moved in with me. She's not, thank God, but let's assume she did. Okay. Let's assume she's fine. She's fine. She's healthy. She's just moving in because, I don't know, my dad died or something, but my dad's healthy and he's alive. Anyway, she moves in after a couple of weeks. I come home and she just seems really lonely. She's fine. She can take her medications. She can cook. She can do all her self-care. What kind of setting might she benefit from? Well, maybe she'd benefit from a community senior center. She's lonely and she just needs some socialization. Okay, but what if after she's living with me for a little bit, she accidentally starts a fire from cooking, or she has a fall, or she takes her Monday medications on Friday? Well, those are a little bit more severe. So what other settings, community care settings, might be appropriate for her? Well, maybe home health. Maybe she needs a home health nurse to come in and do something with her. Maybe she needs assisted living. Maybe she needs long-term care. So be aware of these 5 community settings and be able to place somebody based on a scenario you're giving into one of these settings. So know what each of them is for. Okay. And then there's your practice application. Okay. If you want to do that activity. Oops. No, I didn't want to do that. I didn't want to do that. Okay. So let's get to any questions on that. So that's a lot about the family and risks and assessments. Okay. A lot of information to cover. Now we're going to cover our last chapter, which is my claim to fame, which is school nursing. Okay. Okay. You can go to your study guide too and know what you need to know about school nursing. Again, here's your outline, which is the PowerPoint. Here's your objectives. Read those. We're going to cover some things in here. I may not get to all of it because I am going to stop at 10:55, which gives us 15 minutes, and I want to do the attestation. Okay, so let's get through as much of this as possible. So in the past, how do we look at school nurses, right? They put bandages on and give hugs, right? I can assure you school nursing is much more than that now. Okay. Let's see, I retired last year, so I did 20 years. I can assure you in the last couple of years of school nursing, I was doing trachs, replacing trachs, trach care, suctioning, cathing, both boys and girls, G-tube feedings, replacing G-tubes if they fell out, medication, right? IV medication, PICC line. We do much more now than bandages and giving hugs. That's what my school nurse did when I was growing up. Okay. So let's talk about, we don't really need to get into the history of school nursing, but we do need to know table 31.1. This is federal legislation affecting schools. Okay. I highlighted a few of them. So if you're given a scenario, you need to be able to, what federal legislation is this applied to? Okay. So you have your section 504, right? You can't be excluded from school because of a handicap, right? You have your Americans with disabilities, right? You can't discriminate against kids with disabilities. They have to be in school. No Child Left Behind in your WIC program. The one thing to remember about your WIC program, everybody knows what the WIC is, right? Their meal program, the federal meal program. But the other thing to remember that a lot of people don't know about, if your school or daycare, whatever, is participating in the WIC program, which is the federal meal program, you have to have a wellness policy. A lot of people don't know that, but that is part of the WIC program. Okay. And then your every Students Succeeds Act and your Healthy Hunger Free Kids Act. So just know what those are. You don't need to know when it started and all that, but just know that these exist and what's their primary function. Okay. We in school nursing, the standards of practice that are used, it comes from the National Association of School Nurses. So the 2 primary associations we use in school nursing are National Association of School Nurses and the American Academy of Pediatrics. Okay. What are the roles and functions of the school nurses? Well, a lot. There's there's different models in the country of school nursing. There's some districts that have a RN based in every building. There are other districts like the big one I worked in that we were considered consultants. We had several schools and we trained and delegated health aides or health techs or, paraprofessionals in the schools to do the basic functions of medication administration, diabetic care. All right. So I wore many hats because I was a consultant. All right. So we may be direct caregivers, educators, counselors, social workers, consultants, case managers. Okay. We are the ones responsible for the coordination of care of students, especially the highly impacted students. And I can tell you during COVID, school nursing was was lifted up quite a bit. Okay. We became the go-to for everything. And now we're kind of the go-to for everything. Teachers have questions about behaviors in classes or possibly observing seizures, whatever. They're always calling the school nurse. School nurses play a really important role in the schools. And here's the different roles we may play. Pardon me, just in a little bit more detail. Okay. There's all the roles that we just mentioned above. Okay. Federal school health programs. CDC is very involved in what we do. All right. They've developed different kinds of school health programs. All right. And these are the 10 topics, 10 areas they work with. Schools, health education, nutrition, employee wellness, social and emotional climate, physical health, counseling, community involvement, family engagement, physical activity. Okay, so those are all the issues, all the areas we're looking at in school, right? When we're looking at the whole school together, here they all are. All right, we want our kids to be healthy, safe, engaged, supported, and challenged. And in order to achieve that and improve learning for everybody, all these areas need to be taken into account. Okay. So a couple of different ways we can make sure that happens. Some schools have school-based health programs. Okay. I want you to read through this. This is a good one. This is Healthy People 2020 for school nursing. Okay. There's 5 of them. 1, 2, 3, 4, 6 of them. Okay. Reduce the number of school days or missed days with kids with asthma. Increase vaccination rates. Right? We're trying to get there, we're trying to get here, increase the proportion of the nation's elementary, middle schools, middle, senior, and high schools that have a nurse ratio of 1 to 750. That'd be awesome. My last couple of years, I was at like 1 to 1,800. And when I started, my first 10 years, we were 1 to 3,000 students. So we're trying to, that's the recommendation from National Association of School Nurses. That's the ideal, 1 to 750, 1 nurse to 750 students. Yeah. So that we can care for the whole student, right? Okay, I want you to review this section. They don't even have a levels of prevention box in this chapter because they talk about this in depth in the chapter. Okay, so page 546, you've got to read through this section. Levels of prevention in schools. Don't be looking for the box. It's not there. Okay, so it gives you a real quick summary. Primary prevents health promotion and education to prevent health problems. Secondary, screening, right? Maybe you're screening for height, weight, BMI, monitoring their growth and development. Tertiary, care for children who need long-term care services. Right? Those are our really impacted kids. Those are our G2 kids, our trait kids, our CP kids. This is an excellent visual, 31.2. Okay, breaks down primary, secondary, and tertiary in the schools. Really important. And then below here, below figure 31.2, it goes through these in depth. So if you want to read more and get a better understanding, read through. This is a long part of this chapter, but look at all the how-to boxes underneath. You know, this is primary prevention. So you have a little how-to box here of how to teach young children at school, right? Because remember, primary, we're using education and teaching. Here's your case study that I've given you the answers to. Okay, it comes up in the primary section. This is all in the primary section. Okay, so primary prevention of injuries, substance abuse prevention, disease prevention, vaccinations. What do you do with a family that doesn't want to vaccinate their kids for religious beliefs or medical reasons or personal reasons? What do you do? Well, you try and educate them, that obviously vaccines are the most, is the best to prevent childhood illnesses. But what if they don't go along with that and they don't want to, they don't have to go along with it. That's the wrong word. But what if they choose not to? Then what do you do? Well, you have to try and educate them on the risks of not being vaccinated and what happens if other kids in school, let's say we have an outbreak of pertussis. Well, we used to have a short list of the families we needed to call. That short list was families who weren't vaccinated or families who had kids that were compromised, immunocompromised, right? Those are the families we want to let know, keep your kids home. You should be keeping your kids home until this pertussis passes because your kid is very high risk for contracting it. And if they get it and they're not vaccinated, they could get very ill. So we don't need to stigmatize them. We used to, but now there's lots of reasons people don't get vaccinated. We have to be supportive of that. We have to try and educate them first, and then maybe you have some that will get vaccinated, but you need to assume that 8%, my vaccination rates ran between 89% and 93, 94. So you need to assume that 6 to 9, 10% of kids in schools aren't vaccinated. So something to think about. Okay. I want you to read this section, 548. There's a little nice paragraph about what are some of the reasons they're not vaccinated. If it's not religious belief, it's not medical, what are some environmental issues that might be going on? Maybe they don't have transportation to get to a clinic. Maybe they're not aware of the clinics, right? So have a look at this chapter. Certain low-income families without health insurance may qualify for federal programs that provide them free immunizations. That's great. What if they can't get there? What if they can't get to the clinic? What if they're at a low-pay clinic and they can't afford it? Right? So lots of issues. You have to figure out why. I got lots of families from other countries, no vaccination status, had no clue what was going on. So you got to work with that too. Okay. And then now we're at secondary, page 548. Okay. So secondary, what are we doing? Early identification, screening. Here's a list of some common things kids come to school into the clinic for. But I want to mention this. In addition, children may seek reassurance from the school nurse or even appear to hide in the clinic. All right. Bullying, harassment. Got to be aware of that. You have to put that on the table as well. Okay, if you've got the same kid coming in the clinic for a week at the same time every day at 10:30 and it's between periods 4 and 5 and they're here with a stomach ache, at some point you have to say, I'm not really sure if it's a stomach ache anymore. What's going on? Right. So you have to be, as a school nurse, one of your roles is you have to be able to dig deeper. Okay. Makes sense? And then part of secondary is caring for kids. So in this section is nursing emergencies that the nurse might have to deal with. And that's why you have the box 31.2 dealing with disaster. That's part of secondary. Emergency equipment in the school's nurse's office, giving medication. Right. And then here's your QSIN, your competency we're talking about in this chapter is safety. Ooh, I'm down to 2 minutes. We're still in secondary, so assessing and screening kids at school, maybe height, weight, BMI. How do you screen for lice? Identification of child abuse and neglect, communicating with doctors. I did that all the time. Right. And then efforts to prevent suicide and mental health problems. That's part of your job as a school nurse. And addressing violence at school. And we're in secondary because violence at school, we want to be able to identify kids at risk. Okay. And then tertiary. Okay. How do we deal? They already have the illness. How do we deal with kids with allergies, kids with asthma? And again, you don't need to read through all that. You just need to know what is in each, what's in each level. What are we doing at primary? What are we doing at secondary? In tertiary, we're working with kids with asthma. We're working with kids with allergies, working with kids with diabetes, autistic kids, maybe kids who have ADHD, really impacted students, kids with special needs. Right? And then in schools, we have kids with DNR orders. So having to deal with that, homebound, pregnant teens. Okay. So lots to do in school nursing. And then what are some controversies in school nursing? Well, read through the ethics section. There's always ethics issues. There's going to be ethics issues in schools, in hospice, in long-term care facilities. Ethics is in every part of nursing. Okay. And here they describe the DNR orders, or the ethical issues that go along with that. What if a teen comes in and asks for emergency contraception? What if a teen comes and says, hey, where do I go get an abortion? Right? Lots of things you can be faced with. And then your future trends. You don't need to worry about that, but it's interesting to read through. All right. So that's a quick synopsis of school nursing. Everybody go and pull up their week 2 attestation. I can tell you what the question is. 2 questions. It's what's primary, secondary, and tertiary, and give an example of each. Tell me when you're there. We'll get this done. And Professor Price's class, we can do this. You guys do this as well. Let's get it done. I like to do it at the end of class. I don't know when she does it. I like to do it at the end of class. So it's one less thing you guys have to think about. We get it done. We do it together and it's done. So primary is what? Prevention. Secondary is what?
Screening.
Say that louder so everybody can hear.
Screening.
Screening. Tertiary is what?
Management.
Treatment.
Thanks. I'm trying to stick with the P&P, S&S, T&T. So it's tertiary.
Treatment.
Treatment. Perfect. Okay, let's give an example of each. What's an example of primary?
Family history.
Yep. What's another example of primary? Education to prevent something from happening, right? What's an example of secondary?
Maybe someone who has a BMI of 30, who's at risk for diabetes but hasn't been diagnosed. Maybe educating them on changing nutrition, certain lifestyle habits.
Okay. So screening. Screening height. If we're talking, let's talk about kids for a minute. Let's say we're going to screen for height, weight, BMI. Maybe women, we're going to screen for cholesterol levels, right? Screening. And what is secondary? Early identification and early intervention, right? After you've screened, you're screening to identify. And what's an example of tertiary? Hello, what's an example of tertiary?
Controlling diabetes.
How? What are you going to do?
Through diet program or yep, that's the best I can do right now.
Okay, yep, that's great. So Luciana brought up diabetes. So they already have the disease, the illness. So what are we trying to do?
Maybe
help them treat it, manage it.
carb counting.
Yeah.
How to use insulin.
Yeah. So you might have group meetings of how to make sure they're managing their diabetes, right? How to take your blood pressure or blood glucose, sorry.
Hello. I don't know why.
Who needs to get muted? Okay. So your attestation's done. So when you're done typing, hit submit and you're done. So what else do you have to do? What else is due this week?
NCLEX questions.
And how do you access NCLEX questions since you don't have a link in your module?
Through other classes.
Through your other classes or through your student resources? And what else is due this week?
NCLEX questions.
What else?
Discussion.
Your discussion post.
We have week 1 discussion post. Okay. When is your initial discussion post due?
Wednesday.
Wednesday.
That'd be tomorrow. Okay, so your initial post is due tomorrow night. And then you have till Sunday to do your peer responses. In your peer responses, read the guidelines. Don't just write, I agree, it's great, nice idea. I agree, good job. Look, there's always a suggestion in your discussion question guidelines. When you're doing your peer responses, you might want to mention this. We give you a heads up of what you might want to address in your peers. You don't have to, but we just give you a heads up or give you some ideas of what to address. Okay, so you get that due this week. Again, if you turn things in early, I like to try and grade early as well. I still have to finish out professional development plans for this week, which I will finish by the end of today. Your group, do we bring up group? Everybody got the email about groups they're in, right? I'm talking to my students now. You all know what group you're in, and you all know what case study you're doing, right? That's going to be due a week from tomorrow, right? Because that a week from tomorrow is week 3. And it's treated like a discussion. It's considered in the discussion. It's treated like a discussion question. Your first group project, your final project is due on that Wednesday, a week from tomorrow. And then your 2 peer, you have to go back and review 2 other groups and give them some feedback. Remember, I want it turned in like an attachment, like you just did with your professional development plan. Cover page with your 3 names and your case study. 3 or 4 names, whoever's in the group, and then everybody do it. Please don't separately put everything in the discussion post. Last term, I'm going to pick Marisol, Catherine, and LaShawn. They were in a group last term. I'm just looking at your names. They provided all their answers separately right into the discussion group thread. I didn't know what was where. Okay, I had to go back and find all 3 of them. Nothing was coordinated. This is a group project, needs to be turned in. Everybody's turning in the same final project. So what I'd like to see is everything turned in as an attachment. You can do attachments in your discussion post. So Marisol, Catherine, and LaShawn are turning in the same paper. Has a cover sheet, who they are, what they did, and then they turn in the final document. Don't turn things in separately, please. Make sense? Okay. 2 minutes over, I apologize. Anybody stay on if you have any questions. Thank you for Professor Price's students coming in. Enjoyed having you. Please reach out if you guys know the drill for me. Reach out if you need anything. Okay? Have a good day.
Okay,
Have a good
thank
rest of the
you.
week.
Thank you.
You're welcome. My pleasure.